Ben, thank you so much for coming on today, buddy. Looking forward to this. Firstly, I want to say congratulations on your new role. Exciting times ahead. But if you could just look to give us a bit of an insight into your career to date, what kind of drivers got you into care, and what I guess kept you in care and to where you are now.
Yeah, thanks, Josh. Thanks for having me on. My story, my journey into social care, it's not that glamorous. Unfortunately, I I worked in Woolworths. I'm that old. I used to work in Woolworths when I was at school, and then when I left there and finished school, I went to work in a Morrison's warehouse. It was as soon as I started, it was due to close down. So I finished there. I was living with my grandparents. Long story short, I needed a job, went to the job centre. I was 18, just turned 18, applied for every job in the job centre. And the first job, only job I think that got back to me was the nursing home in the local area. So I went and had an interview there. It was not the greatest interview in the world, but I think they were desperate. I didn't know what I was getting in for. I didn't do any prior research. It was 2006. I genuinely thought I was going to be serving tea to a bunch of old women sat around the fire, knitting and talking about the war. And so it was a big shock for me going into nursing dementia care. I'd love to say I took to it like a duck to water, but I walked into a toxic culture that didn't welcome new people. And it was mainly because I was a very stubborn person that I refused to be pushed out by people who were telling me you don't fit in here, you're not the right person for the job, who people avoided working with me, gave me rubbish jobs, made me work on my own, isolated me. And yeah, like I said, it was just pure stubbornness that I worked my way through that until eventually 6 months to a year in, people kind of realized that I wasn't going anywhere. More new people had started, so it was kind of like fresh meat to go for in a way. So I was then almost assimilated into part of the team, and I worked my way up from there. I in about 2000 and late 2008, 2009, so I've been in job about 2 years by that point. I was growing restless, very there was just a lot of discontent within me about my place in the company. I was about 20 at this point. I had a pretty bad shift. I worked a lot of hours as a care assistant. I was one of those who was doing 50 to 60 a week, plugging away. And I had a really bad shift. Walked past the nurse's station one day. It was about 6 o'clock in the evening, so 11 and a half hours into a shift. Nurses sat at the nurse's station having a cup of tea. And I just, something inside me snapped and I went, Christ, I could do that. This is easy. Sitting at a desk drinking tea. I could do that. I could do your job. So went home and got my laptop out, applied for a nursing degree out of spite, didn't take it seriously, didn't really put any effort into it at all. Just thought, do you know what, I'm just going to do this and prove that I can do your job. Didn't think anything of it. Long story short, got accepted, went to uni, did a mental health nursing degree. I didn't think I was ever going to graduate or qualify, didn't take it seriously, scraped through with the barest of passes. Imposter syndrome was real. Went to work in a nursing home in Monmouth when I graduated because there was no jobs in the area in the NHS when I graduated for mental health nurses. Walked into a culture that was very poor, very toxic, poor leadership from the top down. There's a theme here in social care.
Yeah.
So I'd already kind of walked into two jobs where I knew if I was to lead what I didn't want new people walking into, I'd learned how not to induct people, how not to lead. Hated it there. It was whereas at Castleford House, I'd gotten used to things. Things were improving. It was like going back in time. So 8 months in, I was looking for something, and fortunately, Castleford House had a nurse position come available. I went back as a nurse. I went back and I went, if I'm going back, I'm going to make the most of this and make a career out of it because I was getting a lot of my peers, my nursing peers, both at the nursing home I went to after I graduated and at Castleford House were looking at me and going, "You're young. Why are you working in social care? Why aren't you working in the NHS? Why aren't you working your way up? Why are you limiting yourself to this?" So I figured if I'm going to do it, I'm going to do it to the best of my ability. I pushed and pushed to do a level 5 qualification in management, and I went back in 2013. Late 2014, deputy manager role came available. Applied for it. I was given the job of co-deputy manager because they felt I was too young to take the role on my own. So myself and a colleague were promoted. So we went and did that. And then the position of manager became available in early 2016. I applied for it. I was given it. Took over officially in June 2016. First CQC inspection, September 2016, good across the board. Further inspection in April 2019, outstanding. Re-inspected 2021, outstanding. During my time at Castleford as manager, 18 awards total, some individual, some for the team, including Care and Support West Care Home of the Year and Manager of the Year 2022, which is pretty special. We went there, shortlisted for 4 awards, and came back with all 4 in 2022. That was pretty special. And yeah, it's kind of reached a stage now where I'm looking higher up. I'm looking further afield. And 1st of June will be 8 years that I've been a manager. And yeah, I'm reaching a stage now where my values didn't align with where I was. Nothing bad. It was just I'm looking so far into the future now, and I need to work somewhere that's going to support me with that. That's going to also be looking that far into the future. And I think I found that in my new role. Uh, and yeah, I'm doing a master's. I'm doing a master's in leadership in health and social care. So I started that in September. I'm really looking forward to finishing that and being able to have a master's as well. So yeah, there's a lot going on. I'm really excited for the future. I'll start my new job officially on the 3rd of June, and yeah, I'm so excited.
No, that's amazing, and wow, there's lots to unravel. I guess. Firstly, credit to you for sticking with it. You know, it sounds like at the very early stages, there's a lot of people that would have just thrown in the towel and kind of been, yeah, this isn't for me. This isn't the kind of culture I want to work in. But you've actually used it to your advantage and shown and kind of led. This is how not to do things, and this is how I'm going to be different. That's a real positive to be able to put that spin on it. And it kind of links into something like I saw you post maybe last week or the start of this week about team members. You know, people aren't staff, they're not employees. You're a part of you're collaborative, you're a team, and everyone's kind of an equal. And I guess you've learned that way of thinking and that way of moving forward due to your past experiences. Is that fair?
Yeah, I'm I'm keen to learn. As you see on LinkedIn, I'm reading all the time. I'm an amalgamation of all these books that I've read, all these podcasts I've listened to, all these documentaries that I've watched, and I've learnt a lot that words are really powerful. One of the things that I set out to do as a leader at Castleford was to almost flatten the hierarchy. You need a hierarchy. You do, especially in social care, you do need a ranking system. It's impossible to work in a system whereby everyone's the same, of equal rank and gets equal say. What I wanted to bring in was a collaboration whereby when I started off in as a care assistant, nurse said jump, you were 6 feet in the air before you were asking how high you had to jump. You know, it was basically that the nurses controlled what you did. You just went and followed their instructions. And what I wanted to do was bring in a much more collaborative approach whereby absolutely anyone could question absolutely anyone about absolutely anything and get an answer. And if they didn't like the answer, they could seek further information about that. For example, nurse goes, "Can you please assist this person to bed?" Okay, can I ask why I'm assisting this person to bed? and then they would get an answer because they're due to have a seizure because their posture is poor, whatever. And then it's a learning opportunity for the care assistant. Why is their posture poor? Is there anything else we can do that doesn't involve them going to bed? And having those conversations so that everyone can learn, everyone can work collaboratively. The care assistant isn't afraid that they're going to get shouted or snapped at. The nurse is happy because they're working in a team that is trying to learn and trying to develop. And that's what I wanted. And I didn't want to work in an environment where everybody knew there was a ranking system. You're working with people. I changed terminology very quickly. So one of the things that I absolutely detested was the terms residents, toileting, hoisters, doublers, singles, walkers, all that sort of thing. I despise that with a passion. And it's about drilling into people early on that you don't stand at the nurse's desk with an allocation and go, right, you're toileting all the singles, you're on the turns, they're feeders. That stops their people. Keywords were assist, support, encourage, and help. You're not toileting someone, you are assisting them to the toilet. You're not taking them to bed or putting them to bed. You are supporting them to go to bed. You are helping them to bed. And yeah, it's takes a lot more energy to do that, a lot more thought process, but it's humanizing people. And to try and drill that into people, that's where I came up with the elimination of staff, employee, and that sort of thing. And you're working for me. And I developed this whole, it was subtle. I didn't drill this bit into people, but I would always refer, if you ever look at any of my LinkedIn posts, if you talk to anyone I worked with them. I didn't work above them. I worked with them, and they were team members. They were my team, or they were people. And that was really important to me that people were aware of that. It's like I put in my LinkedIn post that you've just referred to. There was someone on nights that I work where I worked, and she'd been at Castleford for 20 odd years, 25, possibly even longer than that. And she was very clear. She used to say it quite frequently, look, if I went, you would replace me like that. There's no loyalty. Which, to a point, one, she's right. If she was to leave, I'm not going to stand there and be all like, oh, well, no, she's gone. I'm going to keep her job available for 3 weeks in commiseration that she's gone or whatever. No, I'm going to replace her. But people shouldn't feel that way. They shouldn't feel that they're replaceable. They should feel that you are invested in them, you care about them. And it's very difficult in an environment where you work with 80 plus people, and I'm very aware I'm going to be working in an environment with a lot more people than that. But people need to feel that you care for them in some capacity, not just as a colleague or a boss or a leader or whatever, but you genuinely care about them as a person. And I made a point over the last couple of years. It was hard to do. It takes a lot of thought process. You got to think on this. I made a point if someone was off sick, for example, I would message them. And it's hard to get this, it's hard to do this without looking like you're the boss and you're checking up on them to see they are really sick. But I would just message them and say, I heard you're not in today because your daughter's sick. Just want to say, hope she's okay. And hopefully we'll see you soon. Something along those lines. And I'd like to think that came off as genuine because it was. And also, I'm also then it gives people the impression that one, they're not going to get in trouble when they come back, but two, as well, it stops it reduces the bitching and bickering on the floor by some of the carers or team members when people are off sick, because I'm showing that I'm genuine, I'm congruent when people are off sick. So hopefully they will then take that into when someone else is off sick, they might message them, or they won't go out and bitch and moan, oh God, she's off sick again, all of that, that they'll be, they will be understanding. And I appreciate that's a hard thing to expect from a team. You've got to lead by example. And if someone's off sick and I go out and, oh God, she's off sick again. Oh, it's outrageous. Oh, we're short. Oh, this is terrible. Everyone else is going to follow suit.
Yeah.
And then the manager's there going, why is there a toxic culture? People are moaning because people are off sick. This isn't fair. Well, it's because you've started that, but you probably haven't realised it. And I said it takes a great deal of thought process. I'm still learning it. I still have slip ups from time to time,
Yeah, of
but
course.
I'm getting better at it. And you need to develop that.
Yeah, no, of course. And it's a real unique approach to moving away from, I guess, the stereotypical way of running a home. Did it take long to get the buy-in? Because obviously, when it comes to culture, it's everyone's got to buy into it. otherwise it doesn't move forward. Was that a challenge in itself, or do people quite like the different
Yeah,
approach?
I got accused of being soft quite a lot, and people would say that, and then they would then be grateful if they were the ones off sick, or if they were the ones who'd made a mistake. And I mean, just talking about that, I was very much, and this is probably controversial in social care. I used to say to people when they started to be aware and mindful that they're going to make mistakes. And at some point, if you're a carer, at some point, you're going to forget to set a motion sensor and someone's going to fall and hurt themselves. You're going to forget to give someone a meal. You're going to forget to give someone a drink. You're going to get asked to do something. You'll get distracted and you will forget to do what you were asked to do. There's a whole number of mistakes people are going to make. I acknowledge that. And I'm not a shouter. If I start shouting, there's something seriously wrong.
Yeah,
And I made it known to people that you're going to make mistakes. It's okay to make a mistake so long as once you've made that mistake, you are prepared to learn from that mistake. So you don't set a motion sensor when somebody falls. Having to ring that, if that person then has to ring the family member and go, I'm really sorry your mum's fallen because I didn't set a motion sensor. I can't really punish them much more than that. Well, I can, but is that any worse than having to explain to the family
yeah,
member? No, it's not. So if we then sit down and go, okay, let's have a look at this. Why did you forget to set the motion sensor? Just didn't think, just left the room, completely left my mind. That's fine. Let's have a look at something called deliberate action. So, which is coined in the book, Turn the Ship Around. So, deliberate action. I'm going to leave the room and I'm going to turn around and I'm going to check that the room is tidy, the motion sensor's set, I've signed the mark sheet, whatever, before I leave. If that person then doesn't set the motion sensor again, and that person and someone else falls, that's fine. Now we've got disciplinary action or something along those lines because this is, it's two mistakes now. We can't be having that. But that can be perceived as soft. But then if people are by someone on the outside looking in, but if they're the ones that then make those mistakes, they're very grateful that I'm soft. Not many people make the same mistake twice. And that's because they're normally quite ashamed and embarrassed. But if I go out there because someone forgot to give someone a tray of food, for example, and that person missed a meal, me shouting at somebody and then being made to feel really uncomfortable by the team because of that mistake, all that's going to do is make them nervous, on edge. It increases the risk that they're going to make that mistake again.
yeah,
And then what happens then? They might hide it because they are afraid of being shouted at, or the team alienating them, or the team not talking to them or talking about them behind their backs. So at least if they're being encouraged to be open and honest, not necessarily rewarded for being open and honest, but they're being encouraged to come forward and they're aware that they've made this mistake. I am so sorry. I'm going to notify the family. I'm going to apologize. I'll sit down with the management and we'll have a look at what we can do to prevent this happening again. That's okay. And I think people make mistakes. They need to be people are allowed to make mistakes. You make mistakes in day to day life. My wife spilt the chip pan earlier and we had oil all over the kitchen. That's not worthy of disciplinary action or whatever. It's just a case of mopping it up and we go again. Unfortunately, in social care, you're caring for people, and the mistakes are normally more severe than dropping a chip pan on the floor. But that doesn't mean to say that you're not allowed to make a mistake, and you've just got to learn from it. And like I said, people might see that as a soft way of looking at things, but I guarantee those industries or those organizations, sorry, where the people who make mistakes, they are dismissed or they're given warnings or whatever because they've made a mistake. Those organizations don't have people staying in the roles very long. And one of my biggest regrets ever, I did discipline or gave letter of concern to two people who had once forgotten. They'd gone on a night check. They'd helped somebody who was incontinent, and they'd forgotten to put the call bell next to that resident. So for an hour or so, that person didn't have the call bell. The person had capacity, was found to be climbing over the bed rail because they were trying to get to the call bell. They didn't want anything, they were just trying to get to the call bell. And unfortunately, this person had a very loud family who were very vocal about how upsetting this was for them and their mother. And I ended up giving disciplinary action. And I that's one of those things that I frequently reflect on and wish that if I could do that again, I wouldn't have done. And that's where I kind of learnt a lot about people making mistakes and how to deal with that effectively.
Yeah, no, it's amazing because it creates that unique culture. I think it's a special way of managing because I think it reflects on your time of the awards you've won. You know, getting outstanding multiple times. You get homes that could be around for 20, 30 years that have never got to that level. But
Mm.
that you only reach or achieve them goals if everybody's bought in to the same outcome. And I think in environments it's important to allow people to be self-aware, accountable, and people make mistakes. But yeah, you're right. In social care, um, mistakes can maybe be slightly more detrimental. But ultimately, you don't walk through a care home door and just become a robot and not and not be human anymore. And I think that's often forgotten that you're still human at the end of the day, who is naturally going to make a mistake. But like you said, if there's the ability to learn from it, be self-aware of what happened and kind of move forward. That's the best way to ensure nothing happens again. You said, yeah, the shouting or screaming at someone as soon as a mistake's made is going to only increase that 100%. In terms of kind of working as a collaborative, a team, how is that what's got you to outstanding? And what other attributes do you think you implemented to allow to get to that level, which not loads of homes get to?
I was very fortunate in I had a very good team, and that's partly by luck, partly by design. In that I inherited some people who were exceptional in social care to begin with, so very kind, compassionate, but not to get outstanding is not enough to be kind. It's how you evidence that, and it's how you engage with that. I was very lucky in that I had a very innovative and forward-thinking lifestyles team.
Yeah,
So the team was fantastic, and that was a very big plus for us. And I also inherited some very special individuals who had been with the company for a while, who were very, I said, very innovative and would come up with ideas. And then it was a case of just kind of working on how to bring other people in and work around them. One of the things that I worked out, because I didn't inherit the culture when I started in 2006, like I said, as a care assistant, was awful,
yeah,
toxic, poisonous. When I took over as manager in 2016, that was 10 years later. It was nowhere near that bad, but there was, that there was still an awful lot of toxicity, and it was a case of partly waiting for certain people to leave. There were certain people that were never going to buy into what I was trying to achieve.
yeah,
They fitted a certain culture, and those people in particular were people who would raise their voices if someone made a mistake. They would want punishment or retribution if something went wrong. It was blame culture. It was this person's fault,
yeah,
and those people left eventually through their own design. And then it was about bringing people on board and being very perseverant with the new people and getting across to them, this is what I expect. And eventually, through sheer weight of numbers, what happens is people who are used to working in an older culture tend to get swamped by new people who are working in a new way. And as a leader, the role is one, to lead by example. So if I'm trying to set a very flat hierarchy, I'm encouraging questions and I'm encouraging people to give answers. I can't be seen to be out there denying people the right to ask questions and go back with the wall because I'm manager and that's why, because I said so. And also it's about making sure that I'm not saying one thing to one person and then going and talking about them behind their back to somebody else. It's about making sure that I'm very consistent in what I do and making sure that the newer people see that. And eventually the people who have been there before, who when I was manager, they left or they were assimilated into the new culture. And the culture took a shift it shifted several times while I was there, depending on a variety of factors, the way that social care was going. funding. When I took over, the home was half full. It was half full. So then that required one sort of culture, but then the home was full 6 months later, and then we had to change because we had a lot of new staff and a lot of new residents and a lot of new training to do. So I'm very communicative. I'm the sort of person who I won't sugarcoat things. I'm quite happy going into handovers and telling people this is how it is. I don't know, with 4 beds down, if we don't bring in another 2 residents over the next couple of weeks, I'm going to have to cut your hours. Unfortunately, really sorry for that. Rightly or wrongly, that's my style, and I feel that everyone needs to know what's going on. I'm really sorry that your pay rise wasn't great this year, but unfortunately, the company itself isn't doing so great in terms of occupancy. So hopefully, if that improves next year, you'll get a bigger pay rise, that sort of thing. And again, whether that's right or wrong, that's my style. And I feel that one, people aren't stupid, and two, they need to understand the reasons behind certain things as well. So that was always the way that I led. And it's easy to bring people on board if they feel they can trust you. So if I'm there going, I want to get outstanding and I want to get it because, and the main reason I wanted to get the outstanding was because there's 2 reasons. One was I wanted it because one of the other homes in the company had achieved it before us. And I kept saying to people, they ain't better than us. So you need to look at them and go, I'm better than them. And I want to get this to prove we're the best. And two, because I wanted the team and the residents to know that they were either providing or receiving the best standards of care and be very confident in that. And then when we got the outstanding rating, that changed to no home in the company has got a second outstanding because the home that got it before us lost it. So that was the new challenge was, well, they lost it. We ain't going to lose it. And we're not going to lose it because you're better than them. You're better than everyone else. You're better than the homes in the area, homes in the country. So you need to go out there and prove it. And we 2 years later, we were able to retain it, which was amazing. And that's not just because of me. I don't take a great deal of people give me credit for it. I don't like to take the credit for it because there's 70 to 80 people working there. I'm just one person. I'm not responsible for the outstanding standards of care. I'm kind of the conductor there. I'm the one pointing the baton. They're the ones that have got to go out there and do it. And the standards that the inspector saw were top tier, were exceptional. And one of the things that helped, and I think other places could learn from this, which I see. I don't see it enough when I go out and about to homes. I've reinforced to people that CQC are not the enemy. So when they come in and inspect, I want my team to be banging the door down to the office, trying to see the inspector to go, you need to hear this amazing story that I've got about this person that I cared for, and I made them smile, or they were bedbound and we managed to get them out of bed, and all this sort of that's what I want. And during inductions, I'll say to people, right, you've been here 5 weeks. Tell me a really positive story from what you've had in these 5 weeks. And they'll say something. Okay, remember that because if an inspector comes in, I want you to tell them that story. I don't want you to ruminate on what's wrong, what you're not happy with. Tell them if you want, but make sure you tell me first. But I want you to tell them that story because that's amazing and they need to hear that story.
Yeah.
And I don't want inspectors to come in and people to bolt for the doors, to hide. I don't want inspectors. Well, now the inspectors are calling people, aren't they? And I don't want them hiding behind. I'm not going to ask the fiver. I say to people, you should want to speak to these people to tell them what you do and be proud of it
Yeah.
because that's what social care is all about. And if you can do that, yeah, you might have a few moans and groans. Make sure you bring it to me first. But you might have a few moans and groans. Everyone's got moans and groans. Everyone's unhappy about something. But you also need to be proud of what you do. And yeah, that was something that I tried to reinforce quite early on as well. So that, like I said, when the inspectors came in, people weren't hiding, and I'm very, I say to people, if your mind goes blank, not an issue. Go back to them later and say, look, I'm sorry, I forgot the 5 principles of the Mental Capacity Act when you were with me. I've gone away, I've thought about it, I know it now,
Yeah.
and I've remembered it. So and I'm not going to shout at people for forgetting these things. You're on the spot. It's a high pressure situation. So yeah, it's about getting it across to people that they need to be proud of not just where they work, what they do, and work to a certain standard. I keep saying to people when they pass their induction, I'm confident. I'm passing your induction because I'm confident that if an inspector walked in now and saw you working, they would say that's exceptional. And that's what you need is, that's what you need is a certain standard of person working with you. I was very brutal and cutthroat in my inductions. So I'd go to all these retention conferences and they'd say, can you come and talk to us about retention? My retention stats be shocking. But when you break my retention stats down, they're shocking for people in their induction period because people would start and you'd go after 2 or 3 weeks, they haven't got it. So I'm going to give you a chance. You've got 2 more weeks to meet these targets. And if you don't, unfortunately, you can't work here because you don't have. Maybe you could work in another care home that's got lower standards. Maybe go work in a different sector and be exceptional in that. But for us, if you work here, our standards will drop and we can't have that because the people who live here deserve so much better than that.
Yeah.
And very rarely did people step up. They normally just went, all right, fine, thanks a lot. I'm going to go then because I can't achieve that standard that you're expecting me to achieve. And that's fine. That's not my loss. It's not their loss. They might go on and work at Tesco's or even go into domiciliary care or supported living and excel in that or something because they're just not cut out for nursing dementia care, for example.
Yeah, and not every environment's going to work for everyone. And like you said, people, you want to keep. You don't want to break. You don't want a kink in the chain. You want everyone needs to come in and be at this certain level to maintain those standards. Because I think as soon as you see one or two people dropping off, that's easily filters through the rest of the team. But achieving outstanding once is amazing. Maintaining it is next level, and that's something to be extremely proud of. In terms
Oh,
of
yeah.
kind of good, and in terms of you know a manager now looking to be like, what can I do to get my home to outstanding? What's the kind of top three things you would say they need to start looking at to kind of get to that level?
First of all, I would recommend getting a mentor. That was one of the mistakes I made when I first started was I tried to just bluster my way through it and swagger my way through it.
Yeah,
Even if the mentor's not doesn't work in social care. You need a mentor for two reasons. One, to bounce ideas off of and just kind of learn and reflect. This has happened and I need some perspective. And sometimes having perspective is all you need. And the second reason is you need someone to talk to when things are going horribly wrong.
yeah,
And things are going to go horribly wrong in social care. Safeguarding, poor CQC inspection, numerous things are going to go wrong. I went through late 2020, early 2021. I went through a safeguarding incident that involved the police where a resident was allegedly assaulted by a member of staff. In that time, then we had a COVID outbreak, a nasty COVID outbreak that was then punctuated by two of my heads of department deciding to have a water fight in front of a pregnant member of staff in a kitchen, complete with hoses and stuff as well, which led to disciplinary action. So me trying to tough it out alone ended up having quite a serious breakdown as a result of that. I I was found by Lucy Buxton on LinkedIn, and I can't sing her praises enough. I mention her periodically. She's my go to girl for almost
yeah. I spoke
anything.
to Lucy on this. I think last
There you
week
go.
or the week before. Yeah, she's great.
Yeah, yeah. I mean, people need to have a Lucy, and I'm the Lucy for like three other managers, and I'm really happy to do that, just to be able to give back what Lucy gives to me, and it's great because I also get perspectives on things as well, and I mentor a variety of different people in social care, and it's great to have those engaging conversations and to support people. So that'd be my first advice would be to find a mentor. Ideally someone working in social care, ideally someone with experience in management. But it doesn't have to be. I mean someone with experience in management in general would be a good mentor.
Yeah,
Second would be never stop learning. And it's easy to say because people will go, well, in social care, I do my manual handling training. I do leadership training, I do food hygiene training, I do training, but that is it's not enough. And one of my breakthroughs came during the pandemic. I'd never been a podcaster, never really listened to podcasts, and I started taking podcasting a little. I've been on a podcast. I've been on a podcast called Road to Outstanding, which is worth a listen to, but they stopped doing it at about 2019. So unfortunately, with the new single assessment framework, it's a little bit out of date now. But there's still some great leadership hints and tips on there. But I took up listening to podcasts in 2020, and I read a lot more than I used to. I used to be an avid reader when I was younger, stopped reading for many years, and I've picked, as you can tell on LinkedIn, I've picked it
Yeah.
up again over the last couple of years as well. And it's you never stop learning, and you can never stop being open to new experiences and new ideas. And I talked about this on a Skills for Care podcast because people will say, when have I got time to read like you do? When have I got time to listen to these podcasts, do these webinars? Unfortunately, you've got to make time. And I'm willing to bet that there are a number of times throughout the day where if you stop scrolling TikTok on your phone or stop playing music on the way into work, stopped watching Netflix and actually amalgamated that time, you probably got a good hour, 2 hours in the day where you could go for a walk, listen to a podcast on your way into work, or your way back from work, on your way to do an assessment, your way to your family. It breaks the day up. You learn some great hints and tips and advice. It does change the way that you think and operate. And the amount of times I've been struggling with a problem and listened to something on the High Performance Podcast or Diary of a CEO or the Care Exchange, and I've been able to help me put things into perspective and go, actually, this isn't that bad a problem. And it's also refreshing to hear these really highly successful people and realize that actually they're not that much different to you. They've got struggles, they've got problems,
They're still
their
people at the end of the
struggles and
day, aren't they? That have the same has
yeah,
issues as as much as me and you.
absolutely. Yeah, absolutely. And yeah, it's quite refreshing to hear what these people do, how they overcome these problems. And a lot of it can be boiled down to a variety of simple things: grit, determination, perseverance, meditation, exercise, sitting back and thinking about the problem. So there's so many things you can pick up. So one's mentoring, two being open to learning and making the time to learn. Three, it's all encompassing, but then probably communication. We've talked about the way that I refer to the team, residents, the way that I communicate with the team. I think one of the things that transformed us as well is we found a great communications app. So I used an app called Slack, which I really recommend. A lot of other places use Facebook Messenger or WhatsApp, and that's fine. It's horses for courses, Messenger's Messenger. One thing I found about Slack that was really useful was that it was separate from my other more family and friend orientated apps. So I wasn't going away and opening WhatsApp and seeing that a work chat was lit up with 63 messages. I could mute Slack, I could then install it. That the channel settings on it was excellent. I absolutely loved it. And one of the highlights, and it's quite a sad highlight, one of the highlights I had from using it was when they were announcing the lockdowns. And it was almost like a Twitter feed, I suppose. I was at home watching Boris Johnson announcing the lockdowns, and people were on Slack commenting, I'm a single mum. How am I going to? I've got to homeschool the kids. How am I going to get my hours in? How are we going to do this? How are we going to get through? And then people were just lighting it up with lots of encouragement. Don't worry, if you can't work, we'll sort this out. I'll babysit this. I'll do this. I can do your shopping for you. I can do your shift on Tuesday if you cover me on Friday. It was magical because that was a time when, yeah, the country was kind of falling apart, but the team were really coming together. And that's priceless because for all their bickering and bitching and moaning and groaning that you inevitably get when you've got a team of 70 to 80 people, those times are priceless and special. And it was really worth it to see that and have that. We wouldn't have had that if we weren't communicating. And I've offered communication app to people. I've recommended these sorts of apps to people, and I've had people go, "Oh God, what the hell do I want that for?" And I work 9 to 5. Why the hell do I want to go home after I've been working all week and then have people messaging me going, so and so is off sick for tonight? Well, unfortunately, you're a manager. That's your bloody job. So I really recommend getting a good communications app and using that, and just also listening to this and following the communication hints and tips that I've given throughout the podcast.
Yeah, no, amazing. So yeah, mentoring, kind of continuous learning, and looking at an effective way to communicate.
Yes.
And it's amazing just to touch back on what you were saying about during the pandemic and your team really coming together. It's an amazing to see what how people can pull together in a crisis, and actually people put their differences aside to kind of actually come together to support one another. And there's definitely a lot of positives that came out of that time, for sure.
Yeah, we had two quite nasty COVID outbreaks, but the worst one we had was the first one, which was 2022, late 2021, early 2022, where it was around Christmas time. I'll never forget it because it was Boxing Day, I'm pretty sure it was. We unfortunately had a family, so we had a family working, mum, dad, four kids, three kids, working in a variety of different departments. And they all barring one tested positive on Boxing Day, and it just started this snowballing effect. And anyone who's had a COVID outbreak can probably testify to the fact that it starts with a little, with just kind of like a few, and then it just builds and builds and builds. And it kind of reached a stage where we had that was I think the Boxing Day was on the Tuesday, I think. We didn't get any more cases till the Friday, and unfortunately, the night nurse that was due on shift on the Friday tested positive half an hour before her shift was due to start. We were very lucky in that somebody in the area was able to come in and cover. Went through the weekend without getting any more positive cases, and then we just had a disaster whereby every single person who worked the weekend tested positive on the Tuesday and Wednesday. And this was back in the time when you had to do 10 days isolation.
Yeah,
So yeah, it was like people were walking into work on the Tuesday, were doing their LFD testing, and were literally swabbing their nose and their throat, no symptoms, walking in to sign in and looking at the LFD that they'd only just taken and gone, that's positive. And I start work at 5:30 in the morning, so I'd be there like going, and then it reached a point where you'd put a note out going, "Can anybody work? We've got four have just had to go home because they've got COVID." And people were coming in to cover their shifts and testing positive as they were coming in through the door. And then we did another round of PCR testing on the Saturday, and four people who were on shift on the Sunday who had no symptoms came back positive. So four people already on shift had to get sent home. In total, we ended up with 24 residents and 44 team members positive with COVID.
wow.
And one of my proudest moments from that was that we didn't use any agency at all. I had to do daily phone calls with the infection control team and public health and CQC, and it was a nightmare. It was a nightmare because you'd have kind of a teams meeting and they'd have like six face boxes and all of that, and they'd be there going. You'd have to have one in the morning, and they'd go, right, how, what your staffing levels for tomorrow, because you'd always plan ahead what your staffing levels like for tomorrow, and I'd be going, right, well, I'm five people down, but so and so can do this, so and so, and all of this, and then we'd kind of muddle our way through it. We'd have another team's call in the afternoon then to go, right, how's it looking now? And I'd be there going, right, well, since then we had seven, well, two have just tested positive for COVID, and yeah, it was just so, and we bundled our way through on literally you'd have two people working a long day, then you'd have three people doing, I don't know, 7 till 10, you'd have four people doing a 9 till 3, so the school run. We had a few 17-year-olds and 16-year-olds and 18-year-olds who were still at school and college, and they'd finish school and college and they'd do like 4 till 6 or something like that. And you'd literally bimble your way through with a group of people who were just doing odds and sods here and there. And at one point, it got so bad that we only had four team members in the building. We had our head chef, for four or five, we had our head chef, me, a nurse, and two senior carers. and that was it. That was all we had in the building because everyone else was off. Everyone else was either on a day off or off with COVID. And that, yeah, that was pretty intense and pretty brutal because you couldn't. I said you'd come into work and you'd go, oh, there's 7 people on, there's 7 carers on shift. That's good. And then as you go into handover, 3 of them would come in with positive LFD tests and go, really sorry, I've got to go home. Yeah, it was brutal, but resident care didn't suffer, and you saw the best of the team because everybody mucked in. So people were doing said 3 hours here and there. We had someone, for example, who hadn't been able to work for about 3 months because her husband was in the army and he was deployed, so she had no childcare, and she actually managed to find someone to have her son so that she could just for 2 hours a day, so she could come in and work a couple of hours. And we had someone on maternity leave who actually Kate did her touching base days or whatever they're called during that pandemic. The baby was only about 3 or 4 months old, and she came off maternity leave for a few days to come in for a few hours to help out. I mean, it was remarkable. And yeah, to get through that without agency. I mean, one thing I was really proud of was I never used agency to cover any shortfalls in my entire 8 years as manager. And that, yeah, that might have meant that sometimes the team had to work short. But I mean, every manager knows the old adage, sometimes when the team works short, things go better. And yeah, that was a massive testament to the team pulling together. We did have another COVID outbreak in 2023, but it was nowhere near as brutal as that because the isolation period was less. It was only 5 days by then, I think. And you weren't tested as much, so it wasn't as bad. But that 2021-2022 outbreak was horrific, and that lasted from the 27th of December all the way up to the beginning of March, I think, in
Wow.
total, something like that. It was a really long outbreak. It was one of those that we had a first wave and a second wave, so we kind of reached a point where about 9 days had gone by with no positives, and you were kind of going, "Oh, thank God!" And then someone else tested positive, and you had another wave of people, and it was brutal. And it's really interesting because I'm sure that people will listen to that and people will go, oh my God, I remember how bad it was now. Because people forget we're in 2024, we haven't had the restrictions for ages now. And I'll talk to people. If you remember back to 2020 when we were in the first lockdown, we had a COVID scare. We didn't have any COVID positives. We had a COVID scare where everyone had to go into isolation. We had like an isolation zone, and team members had to like don full blown hazmats. They had visors, masks, long sleeve gowns. It was baking hot, and they had to stay on this top floor. And the spring then was brutally hot, and they had to stay up on top floor. They couldn't have contact with anyone else. They had to go on breaks on their own and stuff. And people forget how bad that was, which is quite scary that people forget that we went through social care went through a pretty traumatic
Yeah.
time. And when I remind people of that, they're just like, "Oh my God, yeah, that was bad." And it's mad to think people forget those things.
No, but even just talking about it now, it triggers your memory, doesn't it? To think, wow, that was only like a few years ago, and actually, the impact was crazy. I
Yeah,
worked, we did a lot of work. The company I was working with back when it all started, we were doing a lot of work down in Devon, and they were hit. Quite a few care homes down there were hit with kind of wave after wave of outbreaks, and it kind of just, the impact it was having on people was it was a mental time that, yeah, it's easily kind of forgotten about now that people, have kind of it's left their memory all of a sudden.
yeah,
But
yeah. It's scary.
yeah, but I guess in terms of kind of, we'll look to wrap up in the next couple of minutes, but just to kind of talk about the agency piece, because I think it's important. There's a lot of providers out there that use a lot of agency, and I think it serves a purpose. It's a need, at times it's needed, especially depending on, the size of your home, what kind of home you are, that sort of thing. But not using agency throughout the 8 years as manager, and kind of was that down to how to work? Was that down to the fact that it has a negative impact sometimes, which I find when you've got different agency members on a different day, don't understand the home, the residents, maybe working slightly smaller staffing team, but actually you're not having to double check someone's work or kind of micromanage them potentially a little bit more. Is that kind of your was that kind of your approach to the lack of agency need?
I think to start with, I agree with what you're saying in that there is a time and a place for agency, and I am absolutely not saying that I would never use agency
Yeah,
and that agency is a bad thing, and that's not that. And it's worth caveating that I have used agency staff. We did have situations where people required one-to-one support that I wasn't able to provide, and we did outsource that to agencies. I'm proud of the fact that we didn't once cover a single staffing shortfall or team shortfall with agency, but we did use agency for in certain circumstances to provide one-to-one support.
yeah,
The main reason that I didn't use it for team shortages, the big one was cost, and I was always of the opinion that if we kept costs down, there's more chance of getting a bigger pay rise for everyone, and that was always a big thought. I mean, we had I can remember once we had a lady who was under a one-to-one for a couple of days, and the a social services were paying for the one-to-one, and the agency carer was revealing to one of my nurses how much he was being paid, and it equivalated to something like £500 for that shift. It was ridiculous. It was a ridiculous amount. It was because he agreed to the shift at short notice. They'd given him a special rate, something like that. And he was getting like £500 for a shift. It was ridiculous. So yeah, it was to keep the costs down. That was the main. If I'm going to have that sort of money, I'd rather it was passed on to the rest of the team rather than to an agency
yeah, yeah.
carer.
No, 100%.
I think people deserve to be cared for by people who know and understand them. And again, I know of agencies who will guarantee you that if you will get block bookings and you can have the same carer for a certain period of time and that sort of thing, and that's absolutely fine. But primarily, we were never in a position where we needed to use an agency for that long for a start.
And that works. It
So I
works
didn't.
well, like you said, with the one-to-ones, isn't it? We'll need this
Yes,
one-to-one for 3 months.
yeah,
Can we have this staffing team? Perfect. It works well like that, doesn't it?
absolutely. And in terms of covering team shortfalls, we were never in that position.
Yeah,
So that wouldn't have worked for us. And I have worked. So I have worked with when I went to the other care home when I graduated, they did use agency. And my experience of that wasn't great because you had an awful lot of people who just didn't really know what they were doing. And it was very obvious they'd been sat in front of some DVDs to be shown how to do training and then just kind of let loose in care homes. And so, and it's one of those that if you are going to use agency, my advice would be to make sure that you veto them you look at them very carefully. I would also never advocate going for the cheapest agency. You need to know what you're getting, and I wouldn't advocate if you've got an agency that's saying they can provide carers for £17 an hour, and you've got an agency that can provide carers for £24 an hour. I'd be looking at the agency for £17 an hour and going, "Where's your income coming from?" Because you can't be paying them very well because the minimum wage is well, it's gone up significantly, hasn't it? Was it
yeah.
£12
But like
something now?
an
11.50.
average PAYE on a minimum wage is probably it'll probably run around £16.50 to run a
Yeah,
PAYE.
yeah,
And it's
yeah,
completely unsustainable to run a business off 50
yeah.
quid. So yeah,
Yeah,
no,
yeah,
100%.
this is it. Yeah, yeah. So I'd be looking at cost as well, and then I'd be questioning. I said, why are that company? Why are they so cheap? So I wouldn't just necessarily be going for cost. And I appreciate that keeping costs down is an organisation's aim. However, you do need to have a look at a variety of other factors, and I would always favour quality, not too expensive, but I would always favour quality over over getting something cheap. You get what you pay for at the end of the day, don't you? You don't go to the Ritz and complain they've charged you £1,000 a night. You go for the experience, don't you? And it's the same. It's the same in this sort of environment. You want something. You want something sustainable.
And the quality and the compliance needs, right? You've got to, you want to make sure that it's the right person. You've got the right to work. So they've got their updated trainings. You put them through, you know, online trainings, but face-to-face trainings. All of that comes at a cost, and it is sustainable at 50p. You're not making that's not happening. It's just a fact. So you're spot on with the balance, isn't it?
Yeah, absolutely. So yeah, so I'm not saying I'm not saying not to use agency. There's definitely a time and a place for agency. And yeah, when it came to the one-to-ones, we were supported very well by the agency that we used. And in fact, with my staffing levels, it actually did reach a point where we were sharing the one-to-one. So when I left Castleford, I had two one-to-ones and we were sharing those 50-50. So I'd even built the team up so that we could cater for the one-to-ones as well. And again, that wasn't down to being dissatisfied with the agency per se. That was down to the fact that the people, in my opinion, need to be cared for by people who know them very well. And no, not it's not just about knowing them very well either. You need to know the environment you're working in, and you need to know, for example, that if you want to, you can go out in the vehicle and go into town. You can come to the management and go, I'm going to take, think of a name, Jane into town for a coffee. Can I have 20 quid? I'm going to, you need to know those sorts of things as well. So you're not just sat there watching her doing whatever she's doing, bored out your mind. You're actually being proactive. So that there was an element of that. But yeah, like I said, there is definitely a time and a place and a requirement for agency, and I wouldn't look down. I think if you're a home that's running on or any care setting that's running on, I don't know, 80-70% agency, there's definitely something seriously wrong there, and I would never advocate for that. But yeah, there is definitely a time and a place for agency.
Yeah, no, amazing, brilliant. Well, I think yeah, let's wrap it up there. I think Avery are definitely very lucky to have you. I think the knowledge and support you can kind of give to the managers within the region that you'll be supporting, and I think they're only going to be better off from that. So yeah, thanks so much for your time today, Ben. Appreciate that, buddy.
That's no problem. Thanks, Josh. It's been great. I've really enjoyed talking to you.
Cheers, mate.
Thank you.